Bismillah. Assalamu alaikum wa rahmatullah, everyone. Welcome, everyone who is joining live and those who are going to be listening to the replay later. Today's session, we are going to talk about breastfeeding for a healthy start. It's going to cover how every mother can enjoy their breastfeeding experience, whether they are working, whether they are pumping, they're a mother of twins, or they want to donate milk or receive donor milk. All cases, how can every mother enjoy their breastfeeding experience? With us today, we have I would say, one of UAE's well-known lactation consultants, although she would not allow me to say so. However, who is joining me today is Sister Nisreen Nemer. She is a certified lactation consultant who is working at a very prominent baby-friendly government hospital in Sharjah. She has previous experience working at prominent respected hospitals across the UAE, including Zuleika Hospital as well as Dubai Hospital. Assalamu alaikum, Sister Nisreen. Welcome to the session.
Walaikum assalam wa rahmatullahi wa barakatuh. Thank you, Sister Sarha.
Thank you.
Happy to join you and the other sisters. Excited to get more in touch with the community mothers.
It's actually our honor to learn from you and have you share from your expertise. Let's jump straight into it for the moms who are here and those who are listening later. Tell us a little bit about yourself, your family, your background, and what is the work that you do?
Originally, I'm a nurse, worked in a government hospital in Dubai Hospital for 13 years, which is a quite very huge experience. And the last few years, I was designed as a lactation consultant. I was dealing with the pregnant women, education and postnatally supporting the mothers with breastfeeding. I did the lactation course in 2006, but I was RBCLC certified in 2008. But at the same time, I have been voluntary active with the Breastfeeding Friends Society in Sharjah since 2004, even before being a lactation consultant, because I found my way and my, let's say, enthusiastic into this field. So I was voluntarily supporting the mothers, then I was certified. So all this journey gave me a strength to support the mothers in the, let's say, the local Arab community, then jumping to a different stage where I left the government to a private sector, Zuleika Hospital, where I was mastering the baby-friendly and the clinical resource nurse. So leading the baby-friendly hospital initiatives gave me another exposure and got in touch more with, let's say, other types of cultures, let's say the Asian culture, the Arabs, and non-Arabic speaking as well, sisters or mothers. So that was giving me another support to string my experience on how to support these mothers. What are the challenges or gaps? I stayed there for almost 3 years. Then I was doing my master's in public health in Hamdan University. And before that, I completed as well my nursing in both Dubai and Sharjah. So my public health was done in 2016, and then I was active in both languages, English and Arabic. I can consider myself one of the first experts who did online counseling 2016, even before Corona. I was already there in the community, supporting mothers through WhatsApp and Facebook. I still have mothers who remembered me since 2014 and face-to-face, and then online 2016. So back to the government hospitals in Sharjah, also I'm working in baby-friendly hospital, leading the mother-friendly hospital because I've been designated as a doula and a child-based educator since 2019. So expanding my way of experience from baby to motherhood and future, let's see how it goes on with another specialties, inshallah.
MashaAllah, tabarakallah. You've taken us through the journey. You're from an Arab background, but you're not someone who is supporting only moms from that, particular community. But you are really passionate about reaching out to mothers from all, backgrounds, the Asian, the Indian, Pakistani, Arab. This is something that also attracted me towards you and your work, which is why I really wanted to invite you and, introduce you to the mothers in our community. You didn't touch upon your own personal, you're also a mother.
Alhamdulillah, I'm a mother. This is the second part of my scenario. I'm a mother of 5 pregnancies, but 4 babies. Alhamdulillah, all will breastfed, alhamdulillah, with different total duration. MashaAllah, tabarakallah. But I had the second pregnancy, a baby loss, when she was 45 days. So I even get an experience to support mothers who lost babies after birth or who lost babies even during pregnancy, where this gave me more, let's say, Allah is utilizing me to the community to support such mothers on how to overcome these changes or challenges, or how to accept the wish of Allah of taking this baby away from her. I'm able to support mothers as much as I can. I have some connections where I can guide them, where they can lead some support for future. And Alhamdulillah, as a working mother, also that's another experience. So I was working and pumping for some babies, not working, not pumping for some babies. I had this case of late preterm baby, which is not premature, but again, that is another scenario challenge that I am exposed to support mothers who have late preterm babies. Just to brief it, late preterm babies, babies who were born between 34 weeks to 36 plus 6 days, not even 37. 37 considered normal baby. So late preterm between 34 to 36 plus 6 days. Okay, and sometimes 32 to 34, if they're stable, we consider they're like within our group. With the other normal babies breastfed with minor challenges like sore nipples for the first baby, jaundice babies in between, all these scenarios I've been through. But being a lactation consultant and knowing my resources and my advocate people, I could overcome these challenges in the best plan with no formula, inshallah.
Subhanallah. So that means you are not only a lactation consultant by experience, you are also a mother who has gone through difficult breastfeeding. You are a working mother. You have been working while you were breastfeeding. You have experience with those pumping and freezing, and so you have experience in this in your own life, and you have experience supporting hundreds and hundreds of mothers through their journey as well.
Alhamdulillah.
Alhamdulillah, Alhamdulillah, for all of the experience and for all of the service
Mhm.
that you do for us. I would like to ask, in your experience with supporting moms, most of them here are pregnant moms. What is the main factor that these pregnant moms can keep in mind so that they enjoy their breastfeeding experience?
This is a very important question, actually. Based on my experience, as I said, and I did some minor studies on this in Dubai Hospital earlier, mothers during pregnancy should be educated. Now, regardless of, let's say, how much she got being educated, but she should get the education from an expert person, such as a lactation consultant or a peer counselor or breastfeeding educator, doula or childbirth educator. All these titles should be kept in her mind because these are the people who can support her and support the plan of starting and initiating breastfeeding. Now, I will not tell you that you will not struggle. You would be struggling. As a mother, I've been struggling, but I know where to go or how to handle these things. And based on my experience, actually, mothers who were educated during pregnancy or antenatally, the number of challenges were less compared to mothers who were not educated. So we could see the mothers in the hospital when we ask them how you do with breastfeeding or how things are going on. Around 80% they're fine. So the 20% expected challenge, that's any new mama or even second or third mama pregnancy. But the only thing that 80% really makes differences compared to mother who has zero knowledge, where she struggles, she's under depression, she's crying, she's not really comfortable while handling all this stuff, plus the unfortunately starting formula early possible.
Would you say that some mothers go into it feeling as if, oh, breastfeeding, it's a natural thing, it'll come naturally. We'll just see where it comes. Is that something that you come across?
Well, yes, actually, for my current experience, I'm trying to catch up on the mothers who have third babies. I take care of them more than the primary mothers. You will tell me why? I will tell you because she's overconfident, thinking she did everything right on the last few babies. Now, Allah supported them, whatever. But when you teach her,
When you say primary,
means
that means
the first baby pregnancy.
the first time mom. So you mean
Yeah,
that
first time
you
moms.
are you are taking more care to support the third time moms more than the first time moms. Why is that?
Because as I told you, first time moms, we give them more attention. But when a mother comes to the clinic with third and fourth baby, if the lactation is not expert to tackle of her history, she might be overconfidently thinking that either the lactation or the mother they're feeding well. But when I latch the babies to the breast, they're totally wrong. And she suffers from low birth weight after, I mean, discharge. She suffers from low milk supply, cracked nipples, sore nipples. So I feel these mothers, I know that she had a I will not say non-successful, but it wasn't, let's say confidently, a good scenario for the first two babies because she might think I will struggle for a few days and nature came. Yes, it came. God supported them. God gave them that rizq that they were breastfed. But you would be shocked when I correct the latch in front of her and her husband, and they were just thinking, oh, did I do all these two, three babies wrong? I will not say wrong, but Allah gave them that risk coming by itself. But Allah also taught us in Quran and Muslim culture, when you get to know the knowledge, you are obligated to do the right after the knowledge. You will not go back. You will say, I did not know. Why should I not do it? So we don't blame mothers for the previously, but critically, really, I've seen mothers, and يعني, I don't want to say they did wrong, but the latch is totally wrong for this baby. So when I correct them, they were so happy, enthusiastic. I have also successful stories mentioning, saying, I really enjoyed breastfeeding on the third baby, although I breastfed the first, second baby. But they got to know these positive way of latching and overcoming the challenges on this baby.
You mentioned that the mothers should know where they should turn to. Let's say you mentioned IBCLC, you mentioned peer counselors, and childbirth educators. So just briefly, who are these people, like for
Yes.
the moms here to keep in mind?
Yes, this is something maybe they might hear about it or know, or sometimes they seek someone who wants to support breastfeeding, but they don't know about these specialties. Everyone should know, like you will say, a cardiac doctor, ophthalmic doctor, cardiac doctor for the heart problems, okay? Ophthalmic for the eye. Now, breastfeeding counselors or lactation consultants or lactation specialists, regardless of these three terms, they take courses internationally or nationally, depends upon the country, and they're certified after a huge course, detailed course similar to a doctor level. So that's why sometimes we feel ourselves matching the doctor level, but still we are not doctors. So we need to be careful of what we do on the stages of like medicalizing terms or even giving prescriptions. We don't do that, but at least we are able to diagnose and support and do. So lactation consultant will be more expert. The peer counselor will be less, but still she can support as much as she can if she increase her clinical experience. A lactation specialist, sometimes she's similar to IBCLC, or a lactation specialist could be an IBCLC, but she did not recertify later on, because also we recertify every 5 to 10 years. So either by exam or by, let's say, courses. So some of them, they will be like 5 years IBCLC, but she could not make it to recertify. Somehow she will remain as a specialist, but she's not a lactation consultant.
So
Now,
IBCLC,
regardless, yeah, International Board Certified Lactation Consultant.
University
Yes,
for Lactation Consultants.
exactly, the biggest certificate. And you don't have to take care of what type of the title, but the most important, how much she is expert to help you. We have so many of them with different titles. They're expert. Some of them, they're new. Some of them, actually, they just take certificate, frankly telling they're not experts. I don't like to hide this topic, actually, because you need to shop for the lactation consultant like you shop for the doctors.
Your newborn baby deserves to be fed in the best and most natural way possible. And I'm sure that everyone who's here live and listening later, they are listening to this because they have the desire to breastfeed their baby and they want to be able to do it in a successful way. So for that, this topic of shopping around for a lactation consultant, just like you would shop around for the best doctor for yourself, for your
Exactly.
baby, it's the same way. However, I feel that I think you've also experienced this in your practice, is that in our culture, in the Asian culture especially, as I'm from India, we don't usually do it as routine. We don't consult with the
Mm,
lactation consultants in our pregnancy. We don't take a prenatal breastfeeding course or anything. It's almost laughed upon, from our sad to say, from our female relatives, like in-laws, or like you're gonna learn how to breastfeed. I mean, it's a joke.
exactly.
So, what would you say to that in your experience?
Actually, to be frank with you, we share the same culture, actually. Even for Arabs, some of the Arabs, or let's say majority, not even that a small number, majority, they will think the same of the other sisters in Asian part. They think, why would you pay for a lactation course or a lactation consultation, either during pregnancy or after? What which will add to you? Actually, you need to understand, as I just said, we are specialized, well known, and we study for that. So it's not just like I say, I'm a breastfeeding counselor or whatever. So we study, that's number one. So we are similar to any doctor from other specialty, regardless of prescribing medicine or being dealing with investigation, all this stuff. So it's very important to have this in mind that we are available. The second thing we need to understand in let's say in investing or paying money towards a doctor, regardless of he will help you or no, is the similar that you want to pay it for a lactation, but that would be cheaper than the doctor sometimes and cheaper than the formula if you want to really calculate. If you pay for a normal formula, you're paying much more. If you pay for, let's say, a hospital doctor who doesn't support breastfeeding, you are going to go to the doctor like 3 4 times and calculate how many times you pay. Well, if you pay for 1 hour of lactation counseling during pregnancy and maybe 1 hour of lactation counseling after pregnancy, or even getting that support, either paid or not paid, whatever the service, you are going to save much money later on the visiting doctors, necessary or unnecessary, plus the hospital stay. So you just have to think where you put your money and on the top of the expert people. On the other hand, we need to make sure that the nature happened initially before the market of the formula. So we didn't have that pressure of people thinking, I cannot feed, I don't have milk supply, or all this stuff. So all these things have been brainwashed the mother, washed brains, or the mother's thoughts and concept that she cannot do it. So she confidently cannot do breastfeeding. Well, if you don't touch this, it should be confidently there. If you go 3 4 decades, they didn't have formula milk companies. Mothers were breastfeeding in the villages. Even failed to do it, another neighborhood or sisterhood will breastfeed for you, a donor milk, I mean, based on whatever culture approves. Okay. Plus, you didn't have this challenge of all this early, let's say, exposure to formula. Nowadays, every single mother will think, I don't have enough milk. I should have nipple pain. My milk is not enough for the first few days. My milk for the first few days is not good for the baby. If I'm cesarean, I cannot feed. If I'm having a shower, I cannot feed. If I have something to eat, I cannot feed. It's really strange with these myths. So knowledge for this generation is must for my experience.
A lot of birth education and breastfeeding education, it's kind of like detoxing our brain from all of these thoughts that we have. Even about birth, it's like giving birth is like a scary thing, or breastfeeding is it's scary. And at this point, I would like to share, like, for everyone who's listening as well, I had a tough postpartum experience with my first child. And immediately after birth, we were separated. I missed the golden hour. To be honest, I didn't have a prenatal lactation session. I didn't know that I should have that. Because of that, I didn't know what is golden hour. I didn't know about it. I didn't know that it was this special time after birth where I should be starting breastfeeding. So even though I was at the hospital, nobody told me about it. And I missed that hour, and it was like a domino effect after that. It was difficult to get breastfeeding going in a good way, even though Alhamdulillah I breastfed for 2 years. The sleeplessness and everything, it was a challenge. So the second time around, when I was pregnant again, I got in touch with you and I told you that I'm afraid of my due date, because it's going to be the day that I start back again with this bad experience. And we had a very powerful prenatal coaching session where you helped me get rid of the fear. These terms that we don't know about, golden hour, the deep latch, and all of these natural terms, if we don't know about it, we don't know when something is going right and when something is going wrong, isn't it?
Exactly. Yeah, exactly. Thank you for sharing that. But before jumping to this, because I need to make sure that our sisters, they can use the chat box if they want to comment on what we talked or share her own question or thoughts. I can read through and I can reply. So getting back to your experience, actually, I will also share my fresh experience today in my hospital. We had a lecture. We do weekly lectures for the mothers who booked for us at our hospital, government hospital in Sharjah. So coincidentally, I was chatting with the mothers and interacting with them, two of them from Pakistan. The first mother, she was a second baby, and mashallah, she was second month breastfeeding. She said initially in the first baby in Pakistan, she could not feed for 5 days, where they don't give the milk for the first 5 days, they give formula. And I really struggle with all the Pakistani nationalities with respect to the sisters, because I tell them you're the most nationality that they don't breastfeed here in UAE plus in Pakistan. The marketing people there actually doing a lot of telling the mother they don't have enough milk, and who is really powering this, the mother-in-law, both sides, mother or mother-in-law. So they just have to think that I don't have enough milk and keep stereotyping with this. This is really critical for mother who wants to start. Then she was lucky to have her second baby with us this year. So she did not do all of these wrong things in what she did in Pakistan. So baby was skin to skin, initially breastfed as soon as possible. She visited the clinic 3 or 4 times to support, and naturally she's mashallah feeding for 2 months. So she compared the two scenarios, being in a baby friendly hospital or no, or how did she start or no, and how did it really affect her continuity thing. The second also scenario based on culture as well, the same culture as well, Pakistan mother. Her mother was supporting breastfeeding. On the other hand, her mother-in-law was against. She wanted her to not to give not to give the milk as the first 5 days like the other sister, but she was supported by her actual mother who was really breastfeeding. So she was lucky to have that. And making a joke out of this, I told her, okay, lucky that you, she said, I lucky being with my mother's support. But then I told her your husband was following your mother or mother-in-law. He said, no, my mother. Then I was like laughing at this. Regardless of whatever we tried to get a joke of this, she mentioned that this husband was a confident father who likes respecting his mother choices, but he's thinking more logic towards the best of the baby. So he didn't really ignore mother's advice, but he was choosing the right decision. But we just made the joke of mother-in-law scenario just to bring that joke in there. So that is two scenarios fresh for today. I wanted to share with the other sisters that the culture and the hospital practice will affect your decision of starting or not. So be careful, think logically, even if you didn't know the science and the terms, but what you feel is the best for you, use the natural choices.
You brought this up, so let's go into it. The husband's impact and the role in the whole decision to
Exactly.
breastfeed, because breastfeeding, it's not just for 1 or 2 days. According to our let's say Islamic teaching as well, it goes on for a year or even more than that, isn't it? So when it goes on for such a long period of time, it's important that we have that support from our husbands as well, because the sleepless nights, the night feedings, if we're working, we need to pump, someone needs to be there to make sure that the pumped milk, it's a lot of mental work as well. Even though some husbands will say, mothers have been doing breastfeeding forever, what are you making such a big deal out of it? So it's very important that this a prenatal breastfeeding session, wouldn't you say, that the husband should also be a part of it because of that?
Actually, yes, this is what I aim, and this is what is my way since started my LAMSA's community support. However, in baby-friendly hospitals, we do include parents to have parents to be educated together in the pregnancy sessions or breastfeeding session, because now the power that the husband is doing the best to support the mother with the best knowledge. So if he's really educated, so we can assure that the mother will get the good support, because the conflict of having a mother or mother-in-law against the natural wishes. We don't want to say we're not respecting them, but sometimes we need to choose your natural choices or the best choices for your baby life or a newborn. Say as let's say expat mothers or parents who live in the UAE, most of them maybe will not have their family with them. So his support will support the mother choices, even if his mother or mother-in-law was not there. So this is really important.
At this stage, if any of the moms are not convinced yet, quickly, what would you say are the reasons for a mother to choose breastfeed?
The knowledge, the culture, the hospital practice, her wish actually, we need to respect. We do have minor number that mother doesn't want to breastfeed, which is very rare. You need to respect her wish. But maybe her reason of not what breastfeeding based on a scenario she have seen in her sister-in-law or cousin, or a bad concept or movie she has been watching, you need to tell and let's say get the history of her reason of refusing. Now after counseling and she still doesn't want to do it, it's her choice. But most of the cases, 99.9 really, is just affected by your hospital practice, your culture, or your, wrong information from Googling. We teach mothers in the antenatal classes the definition of exclusive breastfeeding. Exclusive breastfeeding means you will only introduce milk to the baby, which is your own breast milk. No water, no sugar, no herbal, nothing, no honey, nothing. Your milk is the first and the only milk will have to continue till the age of 6 months, and start food which is homemade to make sure that is naturally done at home, and continue breastfeeding for 2 years. So it's exclusively 6 months with nothing, then continue breastfeeding for 2 years, okay? Now, the exception here for medical concern, let's say vitamin D or some minerals or vitamins, or baby got sick, God forbid, for some time, it's a medicine that he has to take. That is acceptable. But formula and other stuff you don't need, because everything is enough for the baby. The sisters can also write, whenever we talk about any thoughts, keep in touch with writing in the box. So we will get these information by the end of the session.
So I think the last topic that I would like to, like us to touch upon is the problem, let's say the problem areas, such as working mothers, twins, or even having to receive or give a donor milk. Donate.
Uh-huh.
If we can touch upon these, what it is
Yeah.
and how it's.
Yeah, it's very important for a working mother to be educated early possible, and also after birth, because she needs to know her law, her maternity leave, her number of hours allowed or not, how to manage pumping, when to store, and all this stuff should be discussed. And how much that the baby needs during the separation, if she's able to make it, because so many mothers will work different hours. Some of them will work 6 to 8 or 9 to 12 or even 24 hours for doctors, or whatever the shift. So you need to make sure that what type of work or job you do, what type of stress that you will be struggling, planning ahead, choosing the right pump is very important, discussing these details with an expert lactation that who can give you these details. We do these sessions, and let's say postnatal or antenatal if you wish. These back to work sessions, very details, because we can discuss exactly each individual mother challenge. Although the information will be Googled anywhere, you can get it even from free topics or contents, but individually you need to discuss your scenario, because your scenario is never the same like other sisters, but it could match others in other parts. But the only thing, you need to make sure your individual case should be tackled in details. And for the overcoming of the challenge is, if you really know the knowledge, you plan it ahead, you will continue exclusive breastfeeding even as a working mother. Very rare you introduce formula. The second topic, which is twins, the same thing. We have successful scenarios where mother who got the right information, the right support, family support, she could really breastfeed twins, because God subhanAllah Allah gave us the two breasts. So you can manage one breast for one baby, the second, and alternate. Because we still had some scenarios where mothers who couldn't breastfeed for one side, but baby was growing with one side. So the same thing, when you have two babies, each baby will grow from one side. But we advise to alternate to make sure the milk production is even for each side. So support, pumping, knowledge, you will be able to continue breastfeeding with twins. Now, the last thing, which is also sensitive topic for Muslim culture, but it is there, the donor milk. As I said, if you struggle, especially for premature mothers. Now, for the full-term mothers, we don't have these challenges, because most of the mothers were able to overcome it with pumping or early breastfeeding, support. But premature mothers, sometimes because of the stress, she struggles to get enough milk because she's worried about the baby. The oxytocin level is affected, which is the hormone, love hormone, where it is really needed to be a relaxed stage for the mother to get enough milk. So the donor milk will expect, based on the Islamic culture, both sides should agree, family or husband. Based on the Islamic culture, also you need to agree and make sure that they announce it in both culture, family, so they don't get the marriage of boy and girl. Now, for the non-Muslim culture, that is maybe easier for them. But for the medical background, the donor milk should be screened also for any infection or medical history or something. And she should be a healthy mother eating well. So this is very important, but it happened because most of the Muslim culture do it, but you should announce it in the community for protecting the Islamic law conditions.
I would say from the mother's perspective is that the donor milk can be an option she can consider before jumping into formula milk. Wouldn't you say that?
Exactly. Yes, exactly. I will give you a hint also. The WHO five priorities before considering the breast milk, I mean formula milk. You will have the first priority is your own milk, direct. The second is your express milk. So as a mother, I should express my milk to give it to the baby for any challenge. Now, if I didn't get the first and second, I will get a donor milk, which is step number 3. She should breastfeed my baby directly, giving her the baby or bringing her to my house. Now, maybe she lives away or she doesn't stay near to my town or area. She has to pump. This is step number 4. So she will pump her own milk and give it to me based on the conditions that we explained. Now, if she failed, okay, with this, for non-Muslim countries, you get the milk stored bank, non-Muslim countries, which is step number 5. Then for us, we step only 4 before you get to formula, but for non-Muslim, they step to 5 before you get the formula. So how difficult the people doing it in the medical field? You could not give any formula unless you fail these 4 for Muslims or 5 for non-Muslims. For the non-Muslim, there's like you have a blood bank, we have breast milk bank, but unfortunately is not allowed for Muslim cultures because of mixing all milk donors, and it is not good for us to announce the brother or sisterhood.
You are also someone who is encouraging these connections through donating milk, and I have experience with you as well. I'm saying this for those who are listening, that Nisreen always make sure to connect the premature mothers to the other breastfeeding mothers who are in the community, who may be able to donate their milk to these premature mothers or mothers who are struggling with breastfeeding. So the idea is that lactation consultants, they are here to help us make sure that we are able to breastfeed our babies as much as possible. Wouldn't you say that you would advise the mothers on the situational changes to do in her life in
Exactly.
order to make breastfeeding possible?
Exactly. The mothers need to really get this support as early possible and affordable as they can, because this will help them to overcome these challenges.
With breastfeeding, every day matters. So if you're struggling with breastfeeding and you find that it's probably 1 or 2 or 3 days after you have given birth, ideally you have already gotten your breastfeeding counseling before giving birth. But however, after giving birth and you are starting to struggle with breastfeeding, it's better not to wait for 1 week or 1 month and see if it
Exactly.
improves, because usually those around us, we cannot expect them to give us this medical sort of guidance with breastfeeding. So it's much recommended. The easiest step would be to get the WhatsApp support or the WhatsApp counseling, which you as well, you offer this. The lactation consultants, they offer the WhatsApp counseling where we can just message them and let them know our struggles. We struggling with feeding, or struggling with the latch, or reflux, or throwing up, or any of the struggles that we're having. So as soon as possible, if we get in touch with the support, we are making it easier for ourselves, but most importantly, as mothers, we are making it easier for our babies, because they're going to get that much more of that quality liquid gold, as we can call breast milk. Thank you so much. Jazakallah khair, Sister Nasreen. I'm going to stop the recording and we can look at the comments that we have received. And again, to reiterate, we're going to have a Q&A only session, inshallah, in the coming days. So those of you who are going to be listening later, look out for that in our WhatsApp group for the exclusive Q&A with Sister Nisreen, inshallah.